Hey everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thank you so much for joining me today. I can't wait to discuss today's topic with you. I'm very excited. Hope everybody is staying safe out there, especially now that a lot of states are getting into the transition from stay at home into going out and starting to open up businesses and workplaces. So we continue to pray that everything will remain safe and the cases of COVID will not peak again. Don't forget that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely seek your personal medical advice from your physician or your child's physician. And I hope you enjoy the show. Also, don't forget to check me out on www.delenemushalak.com with all of the fun, new, and exciting things that are going on with me. First of all, Mother's Day is coming up. Unfortunately, with COVID-19, my mom devotional, MOM, is on back order. So if you still want to get a copy of that, go ahead and put your order in. As soon as those get in, I will ship that out to you. Also, don't forget to pick up your copy of my international best-selling Tripsies and Me book, which is super exciting, especially if you have kids. The illustrations are amazing. And of course, my first book collaboration that I'm putting together will be out soon. That is due to launch in June of this year. I'm very excited for that, called Women of War, Peace in the Midst of the Storm. Also a fantastic Mother's Day gift. Definitely go ahead and pre-order your copy. You can do that on my website. All right, so today we're going to delve right into it, and don't forget to watch the entire video because I'll also be giving tips on how to survive COVID and the transition from our stay-at-home back into our regular routines. And unfortunately, I don't think anybody can say that things will go back to completely normal. So today we'll be talking about sarcoidosis, a big word. This month, the month of April, is National Sarcoidosis Awareness Month. So that's why I'm doing a special show on it, just to make people more aware of this disease process. So there will be a lot of big words in this video because sarcoidosis have a lot of big words associated with it. So definitely bear with me. I always make the joke that, we go to medical school and get all these loans so we can learn all these big words. So let's dive into it. So sarcoidosis, I'm sure a lot of people have heard of it. It's become more and more popular in the sense of more people have been diagnosed with it, so the general population has become more familiar with that diagnosis. But what it is what we call a multisystem granulomatous disease. Yes, say that 3 or 4 times, one right after the other. And unfortunately, it is a disease with an unknown etiology. And again, if you watch my videos on arthritis, I've talked about unknown etiology. So pretty much unknown etiology means that we don't know exactly where it stems from or what causes it. So that makes it more difficult as far as workup and being able to tell patients like, hey, this came from X, Y, or Z, and also with prevention, because it's always nice to know the etiology of a disease process, because that helps us to prevent it. So as far as who is affected by sarcoidosis, the most common population is female, and usually the African American population is more so affected by it, and the age range is about 20 to 60 is normally when we see that diagnosis. And I know that's a large age range, but it is a diagnosis where sometimes people can have very mild symptoms, so symptoms may not necessarily bother them, so they don't bring up those symptoms with their physicians. Now the good thing is sarcoidosis is quite rare in the pediatric or the children population, but again, if any of the symptoms that I talk about today, if you're kind of like, you should definitely bring it up with your child's physician. So most of the times, as far as the diagnosis of sarcoidosis, it is what we call an incidental finding that happens. So what incidental finding means in the medical world is, for example, if we get a CAT scan, let's say you're having abdominal pain or belly pain, and we get a CT scan or a CAT scan of your abdominal area, and let's say you're a woman, and usually with the CT of the abdomen and pelvis, we see your ovaries. And I know a lot of women, you've heard of ovarian cysts, and cysts are just fluid-filled lesions that we find. Most of them are benign, which means they don't really turn into anything and they don't usually do any harm. But an incidental finding could be that we did the abdominal CAT scan in order to look at, let's say, your appendix. So we did to look at your appendix, because you're having abdominal pain, but then we have this incidental finding of an ovarian cyst. So that's what incidental finding means, is that we get a test, we're not looking for it, but incidentally we found it. So most of the times with sarcoidosis, the workup starts out because of an incidental finding. If a patient isn't having, again, symptoms that really aren't bothering them too much. And normally the incidental finding is on chest imaging, and the most common one is a chest x-ray. So normally we see what we call bilateral hilar adenopathy. So pretty much we see a little inflamed lymph nodes in the lung region that we say, why are those there? Especially if you have somebody who's previously been healthy, hasn't had any issues. Sometimes we can see what are called opacity, so whitish lesions that we just see that they're a little brighter on the chest x-ray. And normally this leads to further workup. So with that being said, the lung is the most common organ that is involved in sarcoidosis. However, patients can have a multisystem involvement, which I'll talk about later, and they can have other symptoms too. But those are the most common symptoms, are the lung symptoms as far as presenting. So to go right into that, what do people usually come in with? And again, nothing is really textbook. These are just the most common things we see. So normally patients can present with a cough that's been chronic, so more than a month, that just isn't going away. Sometimes shortness of breath. Sometimes people can have a little respiratory distress and chest pain, just feeling uncomfortable, fever, weight loss, fatigue. And I know these are very vague symptoms right now. You could say like, oh my goodness, these are COVID-19 symptoms. And you're so true about that. You're so right that, you know, with COVID-19, we've seen people come in with cough, shortness of breath, fevers, fatigue. So right now, it does get a little tricky. There's that gray area where a lot of disease processes do cross over. So that's why, again, it's important to let your physician or your child's physician know if any of the symptoms that we're talking about occur. Also, you can see weight loss. But like I mentioned, it's a multi-system disease. So sometimes people will present with skin lesions, so like a rash or discoloration, joint pain, dry eyes or dry mouth. So again, there are other things that people can come in with and not necessarily lung presentation. So let's say you present to your doctor, what's going to happen next as far as workup? So usually if you haven't had a chest x-ray yet, usually it would be some sort of chest imaging, and we usually start off with a chest x-ray. If we find something on chest x-ray, it may go up to what we call a high resolution CAT scan, where it gives us a better picture of the lung. There's blood work that will be done a lot of times, because if patients are presenting with that weight loss, fatigue, and fever, which we call B symptoms, you may also get like a TB test, or if you've gotten it before, we call that the PPD. They inject that little area and then they check it approximately no more than 72 hours after you get that done. You may get tested for HIV. So again, you get checked for other things that may cause those same symptoms. Now you may get checked for COVID-19. Again, of course, with the workup, a good thorough physical exam head to toe, because somebody, for example, may be having like a cough, and then when your physician or child physician does a skin check, we notice a skin rash that we're like, oh, have you always had this? And then all of a sudden it's like, no, I haven't had that. I haven't seen that. So on and so forth. So that physical exam. And then of course the history is very important. Some other workups could include a biopsy. Sometimes you may end up needing either like a lung biopsy. If you have a skin lesion that's new, it could be a skin biopsy of that lesion. If you have a swollen lymph node, I talked about the bilateral inflamed lymph nodes in the lung, or if you have lymph nodes in your neck or anything else that is big. And then sometimes they may do a bronchoscopy, which is where they stick the camera, so kind of like an endoscopy, but instead of going into your tummy, they're going into your lung. And usually they can do a lavage where they wash it out, get a good look, and then they take a sample of the cells and biopsy those. Or if you have changes in the lung that they've seen on the CAT scan, they may even biopsy a piece of the lung itself. So a lot of different things are included in the workup. All of this doesn't mean that you're getting every single thing that I listed. Again, that's why it's important to see your doctor and get to the right physician if you need to see a specialist in order to do any specific tests, so that the appropriate testing is done on you as soon as possible. So again, as I mentioned before that, this is a multi-system granulomatous disease. So we see that almost all the organs are involved. So I talked about the skin, the eyes, the lungs. So the heart can be involved, the neurological system can be involved, and that's just your nervous system. Your kidneys can be involved, your muscles, so your muscular skeletal system. I talked about the joint pain. So again, this is a disease that really affects the entire body, and that's why sarcoidosis can be very, very debilitating. So that's something to remember. So let's talk about the treatment. So let's say you get diagnosed with sarcoidosis. The treatment itself, one of the mainstay treatments is steroids or prednisone. Of course, with steroids or prednisone, there are potential side effects to that, especially with long-term use. So we've talked about some things in the past, like decreased immune system or osteopenia or osteoporosis. So those are brittle bones, especially in women. Again, if males are on steroids for a long time too, can also affect their bones. So these are all things that if you end up being on long-term steroids, that also these things need to be checked and make sure that you're doing well. Steroids can also affect your sugars, and some people have diabetes-induced steroids, where it isn't diabetes because of genetic factors or because of your own body, it's because of the steroids that you're using. So again, once again, like I always mention in my episodes, that this is why it's so important to have the conversations with your physician or your child's physician, so you can decide what is the best plan for you, what is the best treatment for you, and knowing all or any of the risks associated with it. As far as potential complications, again, lung complications are huge. Also, it's been found that there's an increased risk of blood clots with sarcoidosis. And then, of course, most of these patients pass away, again, due to lung complications, especially something called pulmonary fibrosis. Also, with the heart being affected, some patients pass away because of a heart attack or a myocardial infarction. So, again, you can see just from the little that I've showed you and just the overview of sarcoidosis, that it's not a pleasant disease. It's something that when patients are diagnosed with, it can become very, very debilitating. There is one other thing I wanted to mention. There is a potential research has been done that there's a genetic component to sarcoidosis. So of course we always ask for that family history, because of course if a patient presents with any of the symptoms that I discussed and there is a family history, that urges us to get that workup even faster for a patient. So awesome. I hope you are more aware of sarcoidosis, what it is, and also being more aware of your own body. Now we're going to skip over to COVID and how to transition safely as we come out of our stay-at-home policies here. So again, as you transition, I recommend great hand hygiene. Continue to do your at least 20-second hand washing of singing either happy birthday twice or singing your ABCs. So definitely continue that, especially if you're touching things, like if you're on the computer, if you're touching a lot of doorknobs. Definitely clean your workstation on a daily basis. At least a lot of people, I myself do it at least twice a day when I get to my office, and then before I leave my office. You want to keep your area clean. Your telephones, also remember your telephone, because you're touching that with your hand. It's also by your mouth. A lot of times we're speaking, you're spitting into the telephone when you talk on the telephone. So you want to keep all of that clean, especially if multiple people are using the same phone. The other thing is social distancing. Again, you still want to continue that. You don't want to be in the lunchroom if there's too many people in there. Really try to keep that 6 feet distance until things clear up. So again, so important to just keep these generalized rules and recommendations that we've had since COVID-19 has started, and just the social distancing and good hand hygiene have been the mainstay of the recommendations. Also, I don't know if workplaces will recommend wearing a mask, especially if you're in closer quarters with other people. But right now there is still the recommendation of wearing a mask once you're around others. Again, we're continuing to pray that as people transition out of the stay-at-home, that things will go well and smoothly as stores open up, as malls open up, as restaurants open up, that things will go smoothly, because we want everybody to be successful. We want your family to be successful, you to be successful, the restaurants, the hotels, the stores, because it's our economy and it's only to our benefit that everything goes smoothly. So again, don't forget to share the video and subscribe if you haven't subscribed yet to the Dr. Mom Show. Don't forget to check me out on Facebook at the Dr. Mom Show. Follow me on Instagram. If you have any topics that you'd like me to talk about, you can always email me at drmomshow@gmail.com. And also, don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Good night. Bye-bye.